Hey there, Justin Jacobs with Health Plan Markets, and today we're going to be talking about the 2022 Medicare Advantage agent commissions and how it all works. So let's dive in. So first thing that you have to know when we're talking about these commissions is this is for 2022, which has already started. So Happy New Year to you, and congratulations for making it through another year. So this is the maximum broker commissions that have been put out by CMS. And I've organized it from high to low. So the highest areas in the country to receive broker commissions are in California and New Jersey. Then it goes down to Connecticut, Pennsylvania, and DC. And then everybody else, pretty much in the country. For us in Florida, that includes us. And then at the very bottom is Puerto Rico and Virgin Islands. So apparently they don't want people making money there. They want you to have a good time. So no money in those areas. Just kidding. It's just a lower commission rate. So if you're doing business in any of these areas, just know that it does vary by where the person is enrolling. Okay. So in the first column here, you're going to see new to Medicare. These are people that are joining Medicare Advantage plans for the first time. And there is an exception to the rule to these numbers. And then we're looking at people that are switching plans. This can be prorated and is prorated throughout the year, and we're going to talk about that. And then this is what the residual rate is for those individuals that are either true upping, which we're going to talk about in just a minute, or that are renewing the policy in 2023. So you enrolled them for January 1st effective, and now in January of 2023, when that policy renews, this is the number that you're going to get is $29.83 if you're doing business in California and New Jersey. For everyone else, it's $23.92 per member per month. That's what that PMPM stands for. So let's go through this real quick. Somebody calls you, you're in California, and they say, hey, I'm turning 65 next month and I want to join a plan. Wham, bam, thank you, ma'am. You are now in the plan for January 1st effective. You just earned $715 if you're in California or New Jersey, okay? For everybody else here, let's go down to the national level. You earn $573, okay? Now, this can become prorated, but we're going to talk about that in a moment. Let's say, same example, somebody says, hey, I'm on this plan X and I don't really like it and I want to switch out. And so in January, you get them set up and you'll only earn $287 instead of the $573. You're going to earn $287 for January 1st effective, okay? Because they're going to be in the plan for 12 out of 12 months, they're going to pay you the full $287, and if you times that by 12, it's $23.92 times 12, and that gives you that $287, okay? So if you're doing business in California, it would be $358. If you're doing business in Pennsylvania, it would be $323, and if you enroll somebody in Puerto Rico, it would be $197 if they're switching from one plan to the next plan for January 1st effective. So their prorated amount is $16.42 versus at the high end in California and New Jersey at $29.83. So hopefully I haven't confused you so far. So let's go forward. Here's an example. Let's say, for instance, a member calls you and like I said before, they're in January, and so this is going to be a January effective date. And you get them enrolled, and we're anticipating that they'll be enrolled for 12 out of the 12 months of the year, okay? So that means that they're going to be enrolled 100% of the year. So because they're going to be enrolled in 100% of the year, you're going to earn the full commission rate for that switch at the national level of $287. So that's how we came up with that number. Now, same example, the person calls you. This time they call you, and it's July. So they call you in July. Half the year has already passed, so there's only 6 months left out of the year. Okay, so 6 divided by 12 gives you 50% of the commission rate. And because it's at 50%, you're going to earn half of that $287, so that's $143.50. So that's what commission is owed for you. But you still get the residuals, which we're going to talk about in just a second here. Now, new to Medicare also has a proration, and this occurs when a person already has a Part D program. So I'll walk you through this map here. So let's say that the member enrolled in Medicare for the first time. Maybe it was 2 years ago they enrolled in Medicare. And whether they chose a prescription drug plan, so they went out and they purchased one, or because they have either Medicaid or they qualified for LIS, it activated their Part D, and so they got an automatic enrollment for Medicare Part D. And because they've got an automatic enrollment in Part D, they are now in the proration aspect of a new to Medicare. So those really nice rates that you see, they are now prorated. So they meet you, they decide to enroll in a Medicare Advantage plan. They've been in MA, or they've been in Medicare only with a Part D for years. They meet you, you get them enrolled in a Medicare Advantage plan, and then here's where that prorated commission comes in. So it depends on when they enrolled based on their new to Medicare rate. So remember, whether you're in California, it's a different rate, or if you're in a national level, it's a different rate. But it is prorated in the same example because they already had a prescription drug plan. And that could be because they bought it, or it could be because they got automatically enrolled in a Part D program because they qualified for LIS. So that's why the new to Medicare rates occur and why it is prorated. And just keep in mind that it's only prorated if they currently have a Part D program. If there's no Part D, there's no proration, so you get the full new Medicare amount. So if you're getting partial commission for new to Medicare, it is not a mistake. It could be because they've already had a Part D program. Okay? So let's talk about residuals, because this is really why we do what we do financially. I do it because I love helping people. It's a great career, and it's customer service oriented. So if you do a great job with your customer service, then you're rewarded in monthly income, month in and month out. So this year at the national level, you're going to earn $23.92 per month when your policy renews in January of 2023. Now, some carriers have decided that, hey, you know what would be great if we did a true up on all of your old business. So let's say you wrote business 3 years ago, and now because the new rate is $23.92, they're going to bump you up to that $23.92 rate on all your old business. So you automatically get a raise every year of about 6% every year, just for doing the same things you've been doing year in and year out, growing your book of business. So how many clients do you need to make a great living? Let's just use a quick example because this is easy. Let's say that you have 100 clients and you're earning $23.92 per member per month. Just times that by 100. We do the move the decimal game, and we just go 1, 2. So now you're earning $2,392 a month to take care of your 100 Medicare Advantage members. It's a great living. So $23.92 for 100 members, times that by 4, you're well over 6 figures at that point. Just doing the business that you do in and year out. So this is a great business to be in. If you are an agent and you're looking for a good home to come to, Health Plan Markets is now bringing on new agents. You can go ahead and visit us at joinhpm.com, or you can chat with one of us at 844-696-3975. We're looking for great talent, motivated individuals, and people that are customer service oriented. I can teach you this business. That's easy to do, but we can't teach motivation and we can't teach attitude. So if you have great attitude and great motivation, we're here to inspire you to get to the next level and help you have a great career here at Health Plan Markets. So thanks again for watching this video. If you have any questions or you'd like to leave a comment, we appreciate that. We're always putting out new content, so feel free to subscribe and we'll get that to you. Thanks again.